Good evening, everybody. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Hair loss, whether it is hair loss in men or hair loss in women, is a very common biological problem all over the world, not just in India. The importance of hair in enhancing the overall personality of a human being cannot be underestimate. Hair is the first thing that people notice about you. A great hairstyle can give you the personality boost you require in doing well on both personal and professional fronts. Hair loss, on the other hand, can prove to be a real disadvantage to people. Many young boys and girls start losing their hair early in life, caused by a variety of genetic, environmental, and systematic factors. Hair fall can affect everyone, regardless of their country of origin. Thankfully, effective hair treatment can control and even reverse the hair loss process. We are here to know more about hair loss, its management, and more in detail about hair transplant from an expert. So let's connect today with our hair expert, Dr. Gulshant Panesar, live from Delhi, to make us aware on hair loss and its management. Dr. Gulshant is a dermatologist and dermatosurgeon in South Extension 2 Delhi and has an experience of 30 plus years in these fields. Dr. Gulshan practices at Dr. G. Panesar's Skin Clinic in South Extension 2 Delhi. She has completed her MBBS from University of Delhi in 1992 and MD Dermatology, Venerology and Leprosy from University of Delhi in 1996. She is a life member of Indian Association of Dermatologists, Venerologist, and life member Cosmetology Society of India. As I told you, she has done her MBBS and MD, and she has done it from Lady Hardinge Medical College. Yes, doctor, very warm
Yeah.
welcome to you. And today we are here to discuss about our hair health, hair loss, and its management. And it's a pleasure to have you with us. So, doctor, as today we are talking about hair loss and its management, my first question to you is that, we all in general shed hairs on an everyday basis. But the thing is that we don't know what is normal and when to be concerned and go and contact a dermatologist. So, how much hair shedding, hair fall, hair loss is normal in general?
In general, in a healthy adult, about 10% of the scalp hair is in the resting phase. By resting phase, I mean which the follicles are not actively dividing or the roots are not actively regenerating. So, that much 10% of the hair would shed in a day, and this roughly translates to 50 to 100 hairs a day. Which, if the hair loss is 50 to 100 hairs a day or less, this is normal. However, if there is more than 100 hairs, and when you take off your shirt or sweater and there's hair on that, there's hair on the floor, and there is hair on the pillow, then it's something which is alarming and you should consult. But 50 to 100 hair a day is not a cause for alarm.
Right. And many a times it also happens that, we don't see much of hair falling, but there is a thinning. We see a lot of scalp. That is also there. So again, in that case, we should go and consult a dermatologist.
Hair fall is a different condition. It's known as telogen effluvium in scientific terms, and it can be acute or chronic depending upon a time that we choose. But the thinning of hair, which you are describing, which occurs in males as well as in females, is hormone dependent, and that thinning of hair is both thinning in the diameter of the hair, that is, the individual hair shaft becomes of thinner diameter than what is normal, and also there's thinning of the density of the hair. So most of the times the hormone dependent hair loss occurs on the top of the head, that is the scalp, that we call as vertex and the frontal areas, and that is what is the androgenetic alopecia or male pattern baldness, and in females known as female pattern hair loss. So the thinning can be usually hormone mediated, and in that the scalp would be visible. So that thinning is a different thinning, and it may not be associated with hair fall at all, and it is usually gradual, so it will tend to progress over the months to years.
And as today we are talking about hair loss, why does hair loss occur?
Hair loss is not always due to a single identifiable cause. There can be many causes which can be leading to hair fall. You're talking of hair fall or hair loss?
They are two different things, right?
Yeah, yeah.
Because so
In hair fall, see, in hair fall, it may recover. You may get your hair back. So in hair fall, which is excessive fall of hair, we call it as telogen effluvium. It can be acute or it can be chronic. Acute is if it's less than 6 months duration, and chronic is if it's more than 6 months duration. And then in acute, usually a hair fall condition may be associated with a past medical illness, a prolonged illness. Like in the past, we've had COVID in pandemic. So 2 to 3 months post-COVID, there can be excessive hair fall. 2 to 3 months after any prolonged viral illness, there can be hair fall. Postpartum hair fall can be there, that is after delivery. There can be nutritional reasons for excessive hair fall, and there can be reasons also in the lifestyle, as in stress or lack of sleep. And last of all, they can be hormonally mediated. So there are many disorders which can cause hair fall. Sometimes there is an underlying systemic illness or a chronic illness, which can also cause hair fall. And sometimes there has been a surgery in the past, or there have been a prolonged drug treatment, a medical treatment, which was for over months, which can also cause hair fall. So these are all the causes of hair fall. So when we have to evaluate a patient of hair fall, we have to rule out these causes on the basis of history and examination.
Right. Many often we say that hair is our crowning glory, etc., etc. And in case anything wrong is happening with our hair or our scalp health, it means that, it's just not about the physical appearance that's getting affected. There, as you said, can be an underlying medical condition. So that makes it even more important that in case we are shedding more hairs, then we should first go and consult a dermatologist rather than trying home remedies or going to the chemist asking for over-the-counter treatment, etc.
Yes, it is very important because excessive hair fall can be a sign of an internal chronic ailment or a chronic problem. So it's important that we go to a certified dermatologist. So I want to bring this to light that hair problems have to be treated by a certified dermatologist, not by aestheticians, not by cosmetologists, and not by self-style trichologists. So it's important that we understand the value of a professional opinion and to go to a correct professional to get the treatment we desire.
Right. But as I said, most of the time, the irony is that people will waste a lot of time in home remedies or asking their friends or family what they did, or going by the social media influencers who are very active these days. And when the case becomes, out of control, that's when they go and contact a qualified dermatologist. Now, dealing, because, all these leads to wastage of time, money, energy, etc., etc., and delay in going and contacting a dermatologist. Can it lead to delay in treatment as well?
Yes, definitely. So it's important to identify the cause as early as possible so that we devise a line of treatment which would be best. As for trying home remedies and asking our friendly neighbors and everybody for advice, if the problem is already self-limiting, that is, if it was due to a temporary reason, that is a temporary stressor, sometimes even shifting the city can be a temporary stressor, the body usually tends to recover on its own. So as it is, the problem recovers on its own over time. But something which is persisting definitely requires medical care. And the earlier the better, the earlier we intervene, the best is the result. And ultimately, we don't lose so much hair that we have to resort to a surgical treatment in the end. So the earlier the intervention is, the less is the likelihood that one will lose density of hair on the scalp permanently. So in that case, then we have to resort to surgical means to get back the hair that we desire.
Fair enough. And do these home remedies work? Because in our society, we have this, notion that oiling our hair, oiling our scalp, keeping the oil on our scalp for as long as possible, putting henna and other ingredients, onion juice as well. They will help in regrowing our hair or maintaining the hair health. Do these home remedies work?
See, the problem with home remedies is that they are totally non-standardized. We do not know what is working. We keep on trying. One keeps on trying one treatment today and another treatment the next week and another treatment the following week. So there is no documented studies. When we take a treatment from a certified professional, they all the treatments are based on studies and documented medical literature. As for the home remedies that you're talking of, oiling is good for certain ages if the scalp is dry. For certainly not for very young people who already produce too much of sebum. So it depends on what age and what is the condition or what is the patient's profile in total. Then when we say, as for oiling the hair, oil acts like a moisturizer. Like we moisturize the skin. So if there is less of humidity and if the strands are dry, one can oil and wash it off, provided it's washed off. It's usually not harmful for the hair, but it's certainly not therapy. I mean, if one is balding, one cannot rely on an oil to get back the hair. It will not be a therapy. It is conditioning. It is an adjunct. If one is taking good care, following a good lifestyle, and if the hair and scalp are feeling dry and one oils and washes it off with a shampoo that suits the hair, it is definitely maybe a good conditioning for the hair, but it's definitely not going to be the mainline therapy. So that is there. And the other thing that you're saying, what using of oil, and the other you mentioned was what?
The home remedies that we apply.
Onion juice. Onion juice is an irritant and has been documented even in medical literature that at times it can increase hair growth. But then again, if we are incorporating a chemical thing from a plant source, when we are incorporating into hair growth medication, we are taking the desired actives, we are combining it to penetrate better, and we are deciding upon the dosage that we have to give. Simply applying anything arbitrarily and washing it off is not going to help. So definitely home remedies can be maybe gratifying, and you may think that you've done something for the hair, but it's definitely not going to produce any desired results.
Okay. And many a times people are so scared of washing their hair or conditioning their hair, because whenever they go wash their hair, they see a lot of hair falling. Then they say that, okay, I'm not going to wash my hair. I'll do it once in a 10 day. What is the reason behind that, or how often should we wash our hairs?
So when we wash our hair, so whatever telogen hair or the hair which are dead tend to loosen off and they shed. So it can be mentally distressing for a patient who's already losing a lot of hair. So too much frequent washing of hair, we definitely don't recommend, unless the patient is very young and the hair is definitely very oily. One can use a daily use mild shampoo, but generally 2 to 3 times, max 3 times a week is enough for hair washing. Too much washing may strip off the essential oils also. So twice a week as a thumb rule is definitely enough for washing for all the age groups, unless the scalp is particularly oily. And when we use a shampoo, you can, by hit and trial, we generally know which shampoo suits us. But again, you can consult a dermatologist if you want medicated shampoos, and mild, all these sodium laureth sulfate containing shampoos, they are mild shampoos, so they can be used to wash the hair.
Right. And what about conditioner, doctor? Is it important to conditioner our hair every time we wash our hairs?
Whenever you use a conditioner, it's not really of absolute essential thing that you have to condition your hair. One can use natural conditioners as well. And when you use conditioners, it's important that you apply it to the tips rather than the scalp. And if it's suiting you, fine. But it's not absolutely essential that the hair has to be conditioned after shampooing. It's usually heavy conditioning is required for chemically treated hair, or if we are using shampooing too often, or there is a definite condition that we require conditioners on a regular basis.
Mm-hmm. How important role a diet, a healthy diet, or a healthy lifestyle, a good amount of sleep, etc., how much they contribute in maintaining our hairs or healthy hairs?
Diet is very, very important. In
Mhm.
fact, hair is, if you're calling it a crowning glory, the shaft of hair that you see on your head is definitely dead. It's only the root embedded in the skin, which is a life part of the hair. So the
Mhm.
as well vascularized and the hair root is, the more robust and buoyant is the hair. So if it is well supplied by blood and the blood contains adequate nutrition, so the hair will produced will be good. And if there is no hormonal imbalance, the hair would definitely be in good condition. So the diet that we take should contain all the trace elements, all the essential vitamins and proteins in the desired recommended dietary allowance as per the weight. And definitely is very, very recommended to have good hair. So diet is the major, has a very major role to play. We cannot be dieting or eating at erratic times
Mhm.
and not having good nutritional support and not having good nutrition. The hair will definitely show signs of ill health and hair fall.
Right. So diet is really important. And as we all know that many a time when hair fall happens, it may be due to some deficiency, iron deficiency, or maybe bad or zinc, etc. Now, the thing is, people are so aware these days, so much information is there, things are so much easily available. Many a times people will just go by themselves, get a, biotin supplement or iron supplement, or a lot of gummies, etc., are also coming these days. They start popping them without even discussing it with their doctor, without even getting a test or lab test done whether they are deficient or not. What's your take on that?
See, blindly popping a hair gummy just because it's advertised on the social media has no role. As I stressed before also, when you visit a qualified professional, the first step to managing any condition is the diagnosis. So when you are not clear about the diagnosis of the hair fall, how can you just blindly pop a gummy? So a gummy would be effective or a vitamin would be effective if there is a, if the deficiency of that particular vitamin is the cause of the hair fall. If the hair fall is due to any other cause, then what's the vitamin supplementation is not going to treat that problem. So the first step to do to manage any condition is a diagnosis. If we do not have a diagnosis in place and we just take a nutritional support, it may provide nutritional support, but it will definitely not treat the condition. So if there is a deficiency of biotin, by all means, it would be prescribed and one should take it. Similarly, if there's deficiency of vitamin D, it should be prescribed. One should take it to control hair, to treat hair fall. If there's deficiency of vitamin B12, it should be popped to treat the hair fall. But just blindly eating hair gummies, which has got a cocktail of all the vitamins, even though you may not have any documented vitamin deficiency, is of no use. So basically, first step and the most vital thing is to diagnose why the hair fall is occurring and which hair fall is it. Is it a pattern hair loss or it is just simple hair fall? If it is going to be, if it's a temporary problem or if it's a permanent problem, or if there are underlying disorders which we need to treat alongside. So that is the first step. And then whatever deficiencies are there, obviously the dermatologist will also correct it and prescribe you the required dosage of the same.
Right. Now, apart from the supplements, because people these days are buying a lot of supplements, apart from the supplements, because the market is flooded with n number of products in the name of hair care, hair health, etc. Influencers are there on social media who are endorsing products, and people are blindly following them and buying those products. As you said, that it's important, by hit and try many times, we also understand that, okay, this particular shampoo or conditioner is working for us. But in any case, one can go and consult a dermatologist and they can actually help us finding the right product for us. Now, for all those who are spending a lot of money every month on products related to hair care just by blindly following ads or influencers, etc., what's your message to them? Are these expensive products really required, or can we actually go without them as well?
See, the market is flooded by too many influencers and advertising, and there's too much information available on Google and all the social media. So the cost of the product is definitely not a guarantee that it is good. So again, a little bit of hidden trial would be, would be required when we choose a shampoo, or we choose a hair oil, or we choose a desired product or a gel or something. But as a thumb rule, all these mild, I told you, the mild shampoos, sulfate free, or sodium lauryl sulfate, or the milder ingredients, those that contain, you can use them as the shampoo. And definitely more expensive just doesn't mean that it is more effective. And also to add, that shampoo is again not, if one has hair fall, shampoo is another thing which is an adjunct. If one has hair fall, just by changing a shampoo, the hair fall will go away, is not going to happen. Hair fall has a definite cause inside the body, and shampoo is just a cleansing agent left on for maybe 2 or 3 minutes on the scalp. So it's definitely not a therapeutic agent. At best, it is something which is providing cleanliness and hygiene so that the hair exists better and grows better. But it's definitely not a therapeutic thing. So it's not that if we use a very expensive product, it's going to be better. We can mix and match, and there can be a little hit and try. And we can definitely use certain serums prescribed which contain growth factors to add to our regime of hair care. So that would be better.
Right.
But as for shampoos, whatever good shampoos and what you've used in the past, and if that's working, I think one should stick to that only.
Right. And one more thing, doctor, that people are really wondering, these days, that what are the basics that we can, products, in terms of products that we can use to keep our hairs healthy or clean at least. So we know that shampoo is important, or conditioner is important, oiling could be one thing. But what are the basic things that we can, keep at our place to help manage our hairs?
Basic as in, see, first is diet. In the diet, you should include, according to the weather and all, the diet should include reasonable amounts of nuts and seeds. By nuts, I mean it has to include some amount of almonds and walnuts, and in moderate amounts, some nuts should be consumed because they contain all the copper, manganese, and zinc, and all the trace elements. Then the seeds, like flax seeds, sunflower seeds, chia seeds, they provide us with, again, essential fatty acids and oils. So all these should be included in the diet. It should contain 3 portions of fruits, which provide all the antioxidants. And one should also exercise and ensure that one has adequate sleep. It's very important. And if one is stressed, to combat daily stress, deep breathing exercises are definitely recommended. As for shampoos, we all know what shampoo would be best for us, or we can even ask a dermatologist to prescribe one. And then there are certain other serums that one can use, which again the dermatologist can prescribe, which contain growth factors, or which contain procapil, or which contain capixil. There are certain serums which you can apply in the dosage prescribed 1 to 2 times in a day, and which will also promote hair health and hair growth. And shampoos, you can whatever shampoo suits you. If you can use that, as long as it's mild shampoo, you can use whatever shampoo suits you.
Right. And dandruff again is another very common condition in our society, people, and especially during winter, we suffer a lot from dandruff. Why dandruff happens? I mean, what are the causes behind that and how to treat it?
Dandruff is a condition which is caused by overgrowth of a fungus. See, our skin has normal flora. It has got bacteria as well as fungi on the surface of the skin, which are friendly to us. So when there is a fungus by the name of Pityrosporum, which is resident on the scalp. So when its count increases, it usually increases in response to hormones. It usually increases in response to maybe stress or certain diseases. So when the Pityrosporum count increases, it leads to excessive dandruff. And then we call it as seborrhea. And at times, if it is forming patches of dandruff, we call it a seborrheic dermatitis. It's common in the young age group, like 15 to 35 or up to 40 years of age. And for that, if it's just simply seborrhea that one is dealing with, one can, use an anti-dandruff shampoo, which there are many anti-dandruff shampoos available, otherwise also over the counter. But the shampoo should contain ketoconazole or maybe climbazole, which are antifungals, can contain ZPTO, which is zinc bioethone, can contain selenium sulfide. So there are various agents which we prescribe. Then there can be coal tar also, which we at times, if it's a little severe dandruff, which we prescribe as content of the lotions or shampoos. So basically ketoconazole or ZPT or climbazole containing, or pyroxalutamine or cycloperoxalutamine, you can read off these ingredients on the label or go to a dermatologist who can prescribe. You can use these anti-dandruff shampoos the way the doctor tells you to, because they have to be applied and left on for around few minutes and then washed off. And then if the problem is more severe, as in there is seborrheic dermatitis, then one may be also at times prescribe an oral antifungal to lower the count of Pityrosporum and to treat the condition. So this is how we treat the dandruff. So basically, if excessive dandruff is again not the only cause of hair fall, it may just be contributing to the hair fall.
Okay. And doctor, when we talk about the treatment, we all know that in case of hair fall or hair loss, we have medical treatment, we have surgical and non-surgical. We would like you to shed some light over these, treatments.
So when a hair fall, as I said, first is to diagnose. And if it's excessive hair fall, if it can be managed by just medications and oral tablets alone, which includes supplements, we should give that. If we need to add certain serums, we can add that. I told you they are Procapil, Capixil, and acetyl tetrapeptide containing serums, which we prescribe in the required dosage of 1 ml twice a day. If this doesn't help, we can even give minoxidil, which is used as a solution form in alcoholic or a non-alcoholic base, which is again 1 milliliter twice a day. And this can be used for continued period. Mostly whenever we treat hair fall, it is to be used for a long duration, like at least 6 months, sometimes even 9 months. So it's a long treatment. These are the topical treatments that we do. Then if this is not helping, and if the cases of androgenetic alopecia or male pattern baldness, we may have to add an oral anti-androgen, which counteracts the effect of the male hormone, which makes a scalp hair thinner. The male hormone's action is to thicken the body hair, but to thin the hair on the scalp. So to counteract the effect of the male hormone, we at times give oral anti-androgen. This is purely on the discretion and the judgment of the treating physician. That is given for a certain period of time again. And these are the medical treatments. If these are not working, or when we have tried this for a stipulated period of time and still not got the desired result, we can step to the other treatments like platelet-rich plasma, in which the patient's blood is withdrawn and a serum is made which is rich in platelets. And this serum platelets contain growth factors. which are autologous, that is derived from the patient's own blood. And those are injected into the scalp to stimulate the hair growth. Again, for this, multiple sessions are required. And then the last resort is the hair transplant, which is carried out if there is Norwood. In androgenetic alopecia, we do Norwood classification. If it's Norwood 3 and beyond, we do a surgical treatment, which is hair transplant, which currently we follow the FUE method, that is follicular unit extraction. And that is done to bring about the desired density of hair on the vertex. So this is the medical treatments and the surgical treatment that I have described.
Right. And as you spoke about hair transplant, who should go for hair transplant, doctor?
I told you in male pattern baldness, that is androgenetic alopecia, it is graded by Norwood Hamilton. Mm-hmm. This grading is done by the dermatologist at your visit when you consult. So anybody who is Norwood 3 and beyond for male pattern baldness, one should consider hair transplant. And also depends on the patient's lifestyle, like, and how worried or disturbed the patient is because of his hair thinning also. So Norwood Hamilton grading 3 and above should go for hair transplant. In females also, there we do a grading of the female pattern hair loss, and for grade 2, grade 3 hair loss, again can consider hair transplant. So hair transplant is a decision which is reached at by a consultation, counseling, and all in which everything regarding the procedure is explained to the patient before the patient ultimately decides and goes for the hair transplant.
Right. And doctor, how long is a recovery from hair transplant surgery? How long the recovery takes?
Usually there has to be a time of at least a week, preferably 2 weeks post-transplant, for the edema and everything to settle. So early recovery usually takes place within the week, but it's good if one has 2 weeks before anything important is planned for the hair transplant, after the hair transplant procedure.
Okay, I'll take some questions from our viewers. Gehna Sahu is asking, does hair get thinner with age?
Yes, hair gets thinner with age due to 2 reasons. First, the cell division becomes less as we age because the cells, the ability to divide and produce viable cells decreases as we age. This is natural degeneration. Secondly, there are hormonal imbalances in women, hormonal changes rather, as the women enter the perimenopausal age group, that is above 45 years of age, or they above 40 years of age in some. The relative, the female hormone concentration begins to decline, and that can contribute to hair thinning on the vertex of the scalp, and that contributes to female pattern hair loss.
So just one more question from viewer that we are going to take. Ishita Jha is the viewer, and she's asking, are there any particular hair care practices that may influence the hair loss?
Yes, they can be. If we're using too much, medically speaking, if we're using too much chemicals on our hair, or if you're using too many chemical procedures like straightening procedures and keratin treatment or rebonding and all these hair treatments which involve application of too many chemicals. So those can definitely contribute to hair fall and even hair thinning. So this, and otherwise day to day, if we are being very harsh with our hair, maybe not using a good brush, or maybe using a comb which is too harsh, or vigorous combing, which is basically using harsh combing or stretching of the hair too much for hair which is already weak or brittle. So that's definitely not a good practice. And excessive use of hair dryers or chemical straighteners is definitely not recommended by the dermatologist.
Right. And doctor, before we wind up the whole session, any take-home message for our viewers?
The take-home message is that if one wants a good hair, one should start looking after it early. That is by mid-teens to 20s, because nowadays I do see hair problems coming at much younger age, maybe even in early 20s. We see male pattern baldness setting in early 20s. So the take-home message is to to do regular exercise, to have a good nutrition, and to keep stress at bay, and also uh, basically these things also, and devise a good hair care regime and start taking care of your hair very early. And in case there is any problem that you see, so it's best to consult a dermatologist, who's the only person qualified to treat that condition. So that's a take home message.
Thank you so very much, Dr. Gulshant Panesar, for your valuable time, ma'am. It has been a very informative session for our viewers, and it was a pleasure to have you with us. Thank you so much.
Thank you so much.
And we really look forward for many more such sessions for our viewers in coming times.
Sure. Thank you.
Thank you. And viewers, thank you for your active participation in today's session.